Let's practice some intramuscular injection site questions. So during your Nclex exam, you will see this kind of problem where they will ask you either the location or they will give you the image and they will ask you the correct location. So if you know the answer, we're gonna practice 6 questions. So let's see if you're able to find the right answer, right? So let's work together. So question number 1. If you know the answer, pause the video and give answer. What do you think? What is the right answer? If you don't want to post, then give answer in your mind, like pause the video and give answer. And I don't want you to see other people options, otherwise your mind will redirect you that you are thinking the same answer. So this is on you because you are going to take the exam, right? So let's solve together. First question is, where is a common IM injection site? Common injection IM site, right? So what do you think? Deltoid, bicep, triceps, or forearm? So in this one, the correct answer would be answer A, because the deltoid muscle, you know where it's located? It's located upper arm, right? And it's a common site for intramuscular injections. The bicep, triceps, all the other and forearm are not typically used for IM injections. So your first answer is answer A, deltoid, right? Now move on to B. The nurse is to administer 3 ml of medication intramuscularly to an adult patient, right? Which is the appropriate site for the injection? So eliminate one at a time. So option A, dorsogluteal. You will never give shot on dorsogluteal because of sciatic nerve is going there. So you should always avoid the dorsogluteal, right? B is vastus lateralis. What do you think about that? The vastus lateralis muscle is thick and well developed, making it an excellent site for injection up to 3 ml, right? So we want to give 3 ml, so this side is good meanwhile, right? Let's go to C, deltoid. So if you want to give shot, the deltoid can hold up to 1 to 2 ml. So we can eliminate this one. And D is lateral preformis. So you never give shot to lateral femoris muscle. So we can eliminate this. So your correct answer is vastus lateralis. That is your right answer, because if you are giving up to 3 ml, then vastus lateralis. If you are giving only 1 to 2 ml, then you can give it to the deltoid, right? Right. The next question is, which site is most commonly used for intramuscular injection? So this is we are going to see, right? Which site is most commonly used for intramuscular injection? Ventrogluteal, abdominal, deltoid, or dorsogluteal? So the best site for intramuscular injection is ventrogluteal. Ventrogluteal. Option A. As I mentioned, you want to skip to option D, dorsogluteal, because you never gave because of the sciatic nerve going on. And deltoid you can give, but mostly commonly used is ventrogluteal. So when you see ventrogluteal during your exam, pick up immediately. If you see ventrogluteal and same time you will see option as vastus lateralis, you should always go with ventrogluteal, okay? This is the most common site to give intramuscular injection. Now we are going to question D. A nurse is preparing to administer an intramuscular injection to a client who is overweight, right? Which of the following sites should the nurse select for the injection? So what do you think? See, in this question they have given ventrogluteal site as well as vastus lateralis, right? So what do you think? So again we gonna go with ventrogluteal site. So option A. The ventrogluteal site is preferred site for an intramuscular injection to an overweight patient due to absence of major blood vessel and nerves, and it has well developed muscle mass and lesser risk for injecting into subcutaneous fat. The ventrogluteal site is the preferred IM injection site for adult and children, but not for infant and toddler. Therefore, the correct answer is ventrogluteal site, right? So go with A. Let's go next question. A nurse plans to administer an intramuscular injection to an obese patient, right? What muscle should the nurse consider the least desirable site for intramuscular injection in an obese client? So you have to read question very carefully. They are asking for least desirable injection site. So what is the least desirable? So as we know, vastus lateralis is the best option. Rectus femoris we don't give there. Deltoid we give it, but they are asking for least desirable, right? So only the option left is least desirable is option C, dorsogluteal. This is no. You must lock this in your mind, like you never give short dorsogluteal. If you see option this, eliminate this one immediately. You don't give short on the dorsogluteal because of risk for injury of sciatic nerve. Got it? So the last question is, the nurse prepared to administer an intramuscular injection to a 4-month-old infant, right? The nurse select which best site for injection. So again, adult and baby we can also give to where? What do you think? The correct answer for this is option 4, vastus lateralis. Vastus lateralis, right? Intramuscular injection site are selected on the basis of the child age and muscle development of the child, right? The vastus lateralis is the only safe muscle group to use for intramuscular injection to a 4-month-old infant. So you can give less than 2 year of age child into the vastus lateralis site. So you remember, this is the main name you must remember, vastus lateralis. Adult and children you can give short to vastus lateralis site. I will post a picture where you will see this is near to the thigh area, right? This is near to the thigh area. You will see picture above. So remember this name, and remember this name not to give short there. Dorsogluteal, right? Don't give short. Okay to give short. This is hold up to 3 ml. Deltoid hold up to 1 to 2. If they ask you question, a nurse is about to give 1 ml of pneumonia vaccine, where would you give? You give it to deltoid, 1 to 2 ml, yeah? Yes. So hopefully review this one more time, and now on hopefully you will be able to crack all of your answer. Yes? Right.